Yeah, and then if we go to the agenda, and I'll just quickly walk through what we have in store today. So first of all, our first presentation will be by Mr. Prashant Purohit, who is a locum consultant in obstetrics and gynaecology. And Prashant will be talking about fertility and conception and the vaccine. And our second presentation will be by Dr. Bhumika Mittal, who's a GP clinical lead in children's and young people's health. And Bhumika's presentation will be around the COVID-19 vaccine and pregnancy. And then following the two presentations, we'll have a short Q&A session, hopefully 10 to 15 minutes we'll have the session, and it's an opportunity for you to ask your questions to Bhumika and Prashant and any of us as well. Any questions that we can't answer, we'll make sure that we take away and follow up with you afterwards. And then once we've done all of that, that would take us to about 35-40 minutes. We'll just finish up by sharing some resources with you on things that you can read after the session, but then also how you can book a vaccine and things like that as well. So as time is ticking on, without further ado, I would like to hand over first to our first presentation by Prashant. So thank you.
Right. Thank you, Sara. Right. So welcome everyone to this webinar on COVID-19 vaccination, and we're briefly going to discuss its impact and if you have any concerns about how it affects fertility and conception. So that's my part. Obviously, most of you guys don't know me. So my name is Prashant. So I currently work as a consultant at the PRUH site, but I often work across the site in some sessions at Denmark Hill. I have special interest in reproductive medicine and fertility, and hence I'm doing this. I do regular clinics at the PRUH site at the moment, and at the King's Fertility in IVF at Denmark Hill. So can we just go on to the next slide, please? Right. So rather than going through more theoretical, what I've done is I've made a slide with most commonly asked questions, and I'm sure these are something that you all want answers to, and it's tricky with what's been happening over the last 1 year. Obviously, you guys have done really well in terms of standing on the front line, giving excellent service to our people. So it's tricky, isn't it, to keep up-to-date knowledge about what's happening. This is constantly evolving science in terms of COVID-19. Every day we turn up and we kind of hear something new. So the whole purpose today is hopefully people who've been working hard haven't had enough time to read through, what are the recent studies and advances that have come out. So hopefully I'll be able to touch on those aspects and improve your kind of perception of what vaccination really means, particularly to people who are not yet pregnant, they're trying for a pregnancy, or even if they're thinking about conception at some point. So I often get asked, like, people who are of the reproductive age group, i.e. You can define that as between 16 or 17 and going up to 45 for natural conceptions, of course, whether they should have vaccine. And the answer is absolutely yes. If you are deemed high risk, if you have got a letter, a phone call, an email from the government that you qualify for a vaccine, that means you should have a vaccine. Obviously, it's all voluntary, but if your concern is, okay, whether it's going to affect my fertility, whether it's going to affect if I'm pregnant or not, then I would say most of the vaccines, so when I say most, there are 4 vaccines which are available currently in UK, and all 4 have showed no adverse effect on fertility. Very important to mention, and I'm talking about both male fertility as well as female fertility. So it's just not for women, for men as well who are thinking about, fathering a child. It's absolutely safe for them to take a vaccine as well. We know that there are not a lot of studies in men. There have been a small kind of group studies in America that they had around 75 men in the study, and they have tested their semen sample before COVID vaccination and 2-3 months after COVID vaccination. And they obviously they tested for two things. One is to check for antibodies within the semen sample, and they have found traces of antibodies, no antigens, so that's quite reassuring. And there have been no changes in the sperm parameters as well as far as men goes. The next question is, can COVID vaccine, can it affect fertility? So giving that example, really, it hasn't had any impact on male sperm parameters at all. Same goes for women. Women who have been trying for a baby, COVID vaccine, especially the Pfizer or the Moderna, doesn't affect fertility. The only issue that has come up from the data that has been collected, especially from Pfizer vaccine, the UK government has received roughly around 13,000 women coming forward and saying it affects their menstrual cycle pattern. So that's the only data we currently have in terms of whether the impact of vaccine on fertility. But it's a bit indirect, isn't it? So we don't really know whether that really affects fertility. Yes, it can cause irregular periods, but it doesn't directly affect fertility. So if somebody is going through fertility treatment, and there is a range of fertility treatments, as most of you must be aware, on one hand, it's as simple as taking some tablets to the full-blown IVF, where you have lots of injections and lots of medications. Again, no direct impact of having a vaccine through that, but you would usually think twice, isn't it? When you are already having so many drugs as a part of IVF, often the recommendation is to space out the vaccine when you're having so many injections, and most of the medications in IVF are injectables. So remember, the vaccine is injectable as well, and it's going to cause pain and discomfort and swelling sometimes at the injection site. So when you're going through stressful treatment, both physically and mentally, often women want to avoid this vaccination. So what you can do is maybe take the vaccination before the start of the treatment, or maybe once you finish the treatment. But nothing to say that you can't take a vaccine through a fertility treatment. The next question is, I've had my COVID vaccine. Should I delay getting pregnant? Should I wait for, say, a few days, few weeks, or a few months after vaccination? Again, the answer for that is no. If you're trying for a pregnancy, you can take the vaccine. You've taken the vaccine today, and tomorrow you want to start trying for a pregnancy, that's fine. The only area, or the only kind of situation where you would want to wait for a pregnancy is if you want to enter the pregnancy with positive antibodies. So if you want to protect yourself, we know that all the pregnant women are not more likely to get COVID-19. But if you get COVID-19 in pregnancy, it's likely to be more severe than when you are not pregnant. So if you are of the opinion that, no, I should be well prepared to go through the pregnancy, then you can choose to have the vaccine, wait for 3 months, and then try for a pregnancy. But again, not because of the direct effect of COVID vaccine on fertility or pregnancy. But be careful in terms of, where you are, how long have you been trying. So I wouldn't advise this for somebody who has been, say, trying for 3-4 years, or who's over the age of 36 or 37. For them, waiting for 3 months or 6 months can have a huge impact on, success rates of natural conception or with IVF. But say you're younger, you're 29, otherwise no cause for infertility, then you can fairly say that yes, you can wait actually. So it wouldn't have an impact on your chances of getting pregnant. But otherwise, if you had a vaccine, there's no reason why you should delay getting pregnant. The next question I often get asked is, I just checked the other day and my pregnancy test was positive, and I'm booked, say, next week to have a COVID vaccine. So potentially you're pregnant, and can you have a COVID vaccine? Now, I think Bhumika in the next talk is going to talk about all this, but I'll briefly touch on this. The answer again from the Joint Committee of Vaccination and Immunization is to wait till the end of the pregnancy. But again, please review the risk factors. So like if you're a health worker, frontline, or from the BAME background, I think it's you would be considered as high risk. And perfectly okay to go ahead and have the vaccine. Last question on this slide is, I've had multiple miscarriages and I'm trying for a baby again. Should I postpone my COVID vaccine, or if I have a COVID vaccine, am I more likely to get miscarriages? Again, the answer to that is no. You are not more likely to have a miscarriage if you get COVID-19 vaccine. But we know that certain complications of pregnancy are higher if you actually get COVID-19 in pregnancy, i.e. the risk of miscarriage is slightly higher if you get COVID-19 infection, not the vaccine. However, we know that the first 3 months of pregnancy are really important. We know that the baby is getting formed, the baby's organs are getting formed. And often most of the clinicians will try and avoid any kind of intervention, whether it's even taking a paracetamol. Probably we try and avoid that till 12 weeks of your pregnancy. So that's the only rationale behind. But if you take a vaccine today and tomorrow you find that you're pregnant, I think it's perfectly fine. It's not shown to have a direct effect on the baby or cause birth defects in the baby. So all this information really that we have regarding conception, periconception, or even in pregnancy is purely observational data. All the other information that you've heard about, links to blood clots and side effects and low platelets, these are all from the randomized controlled trials in non-pregnant patients. Unfortunately, we don't have results of any randomized controlled trials in pregnancy. So this is all based on close to, I think, 120,000 pregnant women in US getting vaccine or who were trying for a baby. So this is all observational data. Having said that, there are now a couple of studies of COVID-19 vaccine in pregnancy in UK actually. So hopefully in the next six to 8 months, once they go through their pregnancy and have a baby, we might have more data in terms of COVID-19. So the take-home message is, if you're trying for a baby, whether men or women, COVID-19 vaccination is absolutely safe from the data that we have. Please risk assess yourself rather than whether you want to conceive or not. I think that's more important, especially all of us who are working as a frontline workers. If think like this. So if you were not trying for a pregnancy and you get a call, you should just behave as if you're not trying. So it doesn't make any difference whether you're trying or not. COVID vaccination is perfectly safe. So I think that's it. If you have any more questions, we are happy to answer that at the end. Just one more slide. I think it's more or less something that I've already spoken. So there is nothing in the vaccine that can affect the fertility of men or women. I've already spoken to you about that. So the decision is still yours. It will always remain yours. So it's all about risk versus benefit. Our duty, who are not really experts, but who keep on reading about all this, is to update you what the latest information is there. We need to be aware that the information is going to keep on changing. That's going to be our norm for the next few months or years now. Constantly updated, constantly new information coming from the trials. Always, if you're in doubt, always discuss with professionals, whether it's your GP. If you need specialist advice, if you're pregnant and not sure, then discuss this with your obstetrician, your midwife, and make sure you understand what COVID-19 as a disease is, what taking a vaccine would mean to yourself and for the people around you. Thank you.
Okay, thank you so much. And thank you for your time today as well, and Bhumika as well, because Bhumika, I know you have to leave at 10:02 as well. So we'll move on to your presentation now, if that's okay, on vaccine and pregnancy. And as we said at the beginning, we will collect all the questions at the end and cover those in the Q&A session. So over to you, Bhumika. Thanks very much.
Thanks, Prashant. Thanks, Sara. I'm Bhumika Mittal. I'm a GP and I'm one of the clinical leads with Southeast London CCG. I've been working with the vaccination programme since January, and I'm also one of the clinicians working on site at some of the local vaccination sites. So I've been lead GP and consenting and vaccinating patients throughout the programme. Next slide. So I'm going to talk to you a little bit about the COVID-19 vaccine and pregnancy and some of the risks and benefits associated with it. And I'll talk you through a little bit about what happens at the vaccination centre as well. So I'm just going back a little bit because I know there's been some conflicting information that was sent out, because at the start of the vaccination programme, the advice was given that women who are pregnant, who are frontline health workers, or who have underlying medical conditions, should be the ones to be vaccinated after having a risk-benefit conversation with a healthcare professional. Since April, that changed. The Joint Committee on Vaccination and Immunisations advised that all pregnant women should be vaccinated with COVID because there was no risk associated to the pregnant woman or to the baby. And Prashant's just talked about a bit about that. And in line with the age groups that were being rolled out, it seemed to have an impact on whether you were pregnant, you should receive the vaccine. The decision to have the vaccine, as mentioned, is completely your choice. And it's a difficult choice for some people, but it is ultimately your choice. We're not here to say, oh, you must have the vaccine. It's just to try and equip you with the correct information. There's lots on social media that is sending out information that may not be correct or may not be evidence-based. So I'm hoping that by the end of this session today that you'll be able to understand what you need to know about the vaccine to help you make that informed decision on whether to have it or not. And then if you have any questions, you can always come back to us or speak to your own GP, midwife, anyone else who's been involved in your care. Can I have the next slide, Emily? So what we do know is the overall risk of COVID to pregnant women is low. In pregnant women, they're no more likely to get COVID than any other adult. However, what we do know is that the overall risk from COVID in pregnant women, as they go further on through their pregnancy, is much higher, and their risk of hospitalisation and needing treatment is higher. So like Prashant said, at the early stages, we don't have the evidence, but we do know that if you haven't had the vaccine and you do get COVID when you're further along the pregnancy, your risks are much higher. The same stands for women who have underlying health conditions and risk factors. They can get more severe and life-threatening forms of COVID. Can I have the next slide, please? The risk factors for pregnant women. So underlying health conditions that we're talking about include immune problems, heart problems, asthma, high blood pressure, diabetes. Other risk factors that can impact a woman in pregnancy are if they're overweight, if they're over 35, if they're in the later stages of pregnancy in the third trimester over 28 weeks. And again, if they're of the Black and Asian minority population, so the BAME background. And you're more at risk from COVID-19 than women of the same age who are not pregnant having these risk factors. One of the questions I get asked quite a lot at the clinics is about the side effects. And there's lots of interesting and stories that people tell you about their reactions to the vaccine and how they reacted and how their friends and family have reacted to it. But like all medicines, vaccines have side effects. Some of them are quite common, which you'd get with any vaccine. Some of them are more specific, but it's helpful to know what to expect when you have the vaccine, and especially if you've got a job, if you've got family to look after, just to be prepared. So in terms of the side effects that you can have, the most common one is a sore arm, an achy arm, can feel a bit stiff. You can get a bit of a headache, feel a little bit flu-like under the weather, achy joints, achy muscles. I felt a little bit sick after my second vaccine, so nausea is one of them as well. But they're all common and they're quite short-lived. They should settle within 24, 48 hours, and with rest and you can have paracetamol, that should all settle down. If the side effects were to go on longer than that, then my advice would be to speak to your GP to check that there's nothing else going on. But very common to have side effects, and there's no rhyme or reason why anybody gets side effects. I've had patients coming up to me saying I had nothing and I was absolutely fine, didn't even notice a thing, whereas others have been quite unwell with them but have recovered quite quickly. So there's nothing to say that if you have this vaccine you'll get side effects, if you have that vaccine, if you have the Pfizer you'd have a side effect, if you have the Moderna you'd have a side effect, or the AstraZeneca. Can I just go on to the next slide, please, Emily? But just to mention, while we're on the topic of side effects, that the risks of the vaccination, You will have heard about the AstraZeneca vaccine, which is the Oxford vaccine, and there has been an association between a very rare blood clotting disorder associated with this vaccine, and that's why it was discontinued or not advised for women under 40. Just to put it into context, the risk of getting that clot is much less than if you were to go on a long haul flight somewhere, or if you're taking the contraceptive pill. So it is a very, very low risk, much more likely to get it from any of those others. In terms of the specific vaccines and pregnancy, there's been no specific safety concerns with any brand of the COVID vaccines with relation to pregnancy. It's just based on the blood clot and relation with AstraZeneca. The Pfizer and Moderna vaccines have been tested in America, like Prashant mentioned, and there's good safety profiles for them and data to suggest that there's no risk to pregnant women or their babies from having them. On the flip side, we're looking at the benefits of the vaccine. We know that the vaccine is effective in preventing COVID infection. We know it helps to prevent serious illness, deaths, admissions. An important point to highlight is that you can't get COVID from the vaccine. It's not a live vaccine. We're not injecting live coronavirus into you. It doesn't contain anything that would affect a pregnant woman or her baby. And we do give other non-live vaccines in pregnancy, such as whooping cough and flu vaccine, and we've done so for many years without any issues. So COVID needs to be considered as one of those vaccines that is part of the process, and we've mentioned that it might be more dangerous in pregnancy. That's fine. And so in terms of at the clinics, I've had women coming in. I've had nurses who've been working up at the London hospitals who have been pregnant and worried about getting the vaccine. And we've spoken through the risks, the benefits of having them. They've got patients on chemotherapy units. I had one specific patient who was in her second trimester and was concerned about having the vaccine, but she was working in the chemotherapy unit at one of the bigger hospitals. And she was worried not only about her own risk, but the risk to the patients that she was looking after. And as a duty of care, as health professionals, we have it to ourselves, to the people we're working with, and to the patients we look after to have the vaccine. AstraZeneca, I know there were concerns around that, but again, I've had patients who've had AstraZeneca in pregnancy and they've been absolutely fine. So in terms of if you are pregnant and you're considering a vaccine, Pfizer and Moderna are recommended, but it's weighing up what would work for you. So it's not saying, oh, you must have the vaccine. It is your choice, and it is knowing that this vaccine would be better, or would this vaccine suit me? When you go to the vaccine centre, you will always be consented before having a vaccine. It's not that you go in and you have the vaccine and then you're asked to leave. You will go in, you will be consented. It will be talked through your risk factors, any allergies you may have, any medical conditions you may have, and your clinical suitability for the vaccine. So we will always go through this, and there'll always be the opportunity to ask any questions if you have any doubts about the vaccine.